Bismillahirrahmanirrahim. My name is Dr. Wajid Ali, and today the topic of our discussion is based upon local anesthetics. Local anesthetics are basically those drugs which are used for the anesthesia, for the induction of anesthesia to the local places or local body parts. Before going into the details of the local anesthetics, first of all, we will discuss about the objectives of today's lecture, and we move to the next slide. Bismillahirrahmanirrahim. In this slide, we will discuss about the objectives of today's lecture. First of all, we will discuss about the introduction or the purposes of the local anesthetics, or what are the purposes of use of local anesthetics. Then we will discuss about the histological background, that when were the first local anesthetics are discovered, and up till now what is the progress in the field of local anesthesia. Then we will discuss about the definition, that how we can define the local anesthetics. Then we will discuss about the properties of local anesthetics, that what a local anesthetic properties must drug have in order to be categorized under the heading of local anesthetics. Then we will discuss about the classification, that how they are classified into different classes. Then we will discuss about the pharmacokinetics of the different local anesthetics. In this, we will discuss about the absorption, distribution, metabolism, and excretion of the local anesthetics. Then we will discuss about the mechanism of action of local anesthetics, how they affect or how they cause induction of anesthesia, and the different theories related to the local anesthetics. Then we will discuss about the clinical uses of the local anesthetics, and then we will discuss about the adverse effects of different local anesthetics, and at the end we will conclude the objectives of all these objectives of this lecture. Now we move to the next slide. In this slide, we will discuss about the introduction or the purposes of the use of local anesthetics. There are basically three different purposes of the use of local anesthetics now for the patients. Number one is the pain control. Number two is the painless treatment, in order to give the painless treatment to the patient. And number third is the comfort of the patient. Local anesthesia or local anesthetics are widely used for the control of pain in conditions such that if a patient or if a person has undergone accident, and the physician has planned to undergo stitches of the underlying lesions or of the underlying injuries, then he must apply local anesthesia to the affected part, and then he will undergo the stitches that are planned for the patient. Then in order to provide a painless treatment to the patient, this is the second purpose, and the third purpose is that in order to make the patient comfortable. So these three are basic purposes of the use of local anesthetics in the field of medicine. Now we will move to the next slide. In this slide, we will discuss about the historical background of the local anesthetics, that when they were first discovered, and what is the progress up till now. First of all, the cocaine was the first local anesthetic agent that was isolated by Neiman in 1860 from the leaves of coca. From the leaves of coca, cocaine was first of all extracted, and it was isolated by Neiman. Yeah, but its local aesthetic action was first of all demonstrated by Carl Queer in 1984. So it means that about 24 years after the discovery of cocaine by the Neiman, its local anesthetic action was identified or demonstrated by Carl Queer in 1984. The first synthetic local anesthetic was procaine, and it was produced by Ian Horn in 1905. Lidocaine is another synthetic local anesthetic that was discovered by Green in 1948. So this was an era from 1860 to 1948 that different local anesthetics were identified, and their local anesthetic properties were identified by different people. But after 1948, a lot of naturally present local anesthetics as well as synthetically prepared local anesthetics were identified, and now they are coming into the market, having good and better efficacy and better use for the induction of local anesthesia in the field of medicine. So this was about the historical background of the local anesthetics, that how they were discovered and what is the progress of their use in the field of anesthesia. So now we move to the next slide. So in this slide we will discuss about the definition of local anesthetic, or how can we define a drug that belongs to local anesthetics. They can be defined as the drugs that cause the paralysis of the local nerves, including the sensory nerve supply, the autonomic nerve supply, and the motor nerve supply, or the motor nerve fibers that are so they are called the local anesthetics. The examples of the local anesthetics include the cocaine, procaine, lidocaine, etc. Now it should be clear that the local anesthetics can be directly applied locally onto the skin to block the nerve supply, or to paralyze the skin that is supplied by the nerves. These nerves can be sensory nerves, autonomic nerves, and motor nerve fibers. The local anesthetic can also be directly injected into the different nerve fibers, like the sensory nerve fibers, the autonomic nerve fibers, and the motor nerve fibers, to paralyze the area that is supplied by these nerve fibers, and to achieve the local anesthetic action. So this was about the definition of the local anesthetics, that the drugs that cause the paralysis of the local nerves, including sensory nerves, autonomic and motor nerves, nerve fibers, are called the local anesthetics. So now we move now to the next slide. In this slide, we will discuss about the properties of local anesthetics, that what are the different properties or different characteristics of drugs that are categorized under the heading of local anesthetics. There are basically six properties that has to be present in the drugs that are categorized under the heading of local anesthetics. Number one is the it should be a non-irritating to tissues of application. It means that it should not irritate the tissues to which this drug is applied. Number two is that it should not cause a permanent damage to the nerves. It means that if the local anesthetic is injected directly into a nerve, so it should not cause a permanent damage to it. Number third is it should have a low systemic toxicity. It means that its local action should be greater than its absorption into systemic circulation. So its systemic toxicity should be low. Because if the systemic circulation absorption of a drug is more, then its systemic toxicity will be greater than its local effect. Therefore, local anesthetic must have a less systemic circulation absorption as compared to its local effect. The local anesthetic should have a low systemic toxicity. Then number four is that its onset of action or onset of anesthesia, the time for the onset of action should be short time. It means that its action should be started immediately or as soon as possible for the induction of for the induction of anesthesia. Then number fifth point is that it should be effective. Either it is applied to the mucous membrane or injected to the nerves. It means that it must work on the mucous membrane as well as in when they are injected into the nerves. Number six is that its duration of action should be long enough for the completion of the desired treatment. It means that when an anesthesia is induced by using a local anesthetic, so it should maintain the anesthesia for a longer period of time so that the underlying procedure like stitching or dressing or any other procedure that is desired should be completed within the given specified anesthetic duration. So these were the properties, and these are the properties that must have be present in the drugs that are categorized under local anesthetics. So now we move to the next slide. Now with this we came to the end of the first part of the local anesthetics, and now we will continue to the second part of the local anesthetics. So stay tuned for the part 2 of the local anesthetics.